infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey, everybody, this is Robert, and welcome to today's podcast, and Happy New Year. And this is a really appropriate podcast for the beginning of the year. And today's guest asked the question, what will the new year bring to our shores, to our cities, and to our homes? And this is in the context of emerging pathogens. And this was in an article recently published in the publication Today's Clinical Lab. Well, let's see what he has to say about this topic on today's show. So joining me today is a returning guest. It's Rodney Rohde, PhD. Dr. Rohde is a chair of the Medical Laboratory Science program in the College of Health Professions at Texas State University. Dr. Rohde, welcome back to the show, sir.
Hello, Robert, and Happy New Year. It's great to be back on the show again.
Same to you. And like we were talking about prior to going on air, I was actually sitting at lunch yesterday pondering 2023's biggest stories, what was going through my head. You know, dengue was an issue, Crimean Congo, cholera, and a few others. And I was thinking, I wonder if anybody's talking about the crystal ball of what's going to happen in 2024, or what are possibilities. And right. I scrolled through social media, and voila, there's your article. And I contacted you right away, and I thought this would be a decent topic to start the new year off with. And to the audience, I'm not trying to scaremonger anybody. It's just ideas and thoughts and predictions. Nobody knows anything, so
right.
To be totally honest. But so I wanted to have Dr. Rohde come in here and talk about some of the things that he wrote about, which were all pretty reasonable. And but before we start with the diseases and the disease categories, for the audience that may not be aware of the terminology, what is an emergent pathogen or an emerging infectious disease?
Yeah, it's a great starting point, Robert. And to your point about, you just mentioned, it made me think of a quote I use sometimes about the only certain thing about emerging pathogens is their uncertainty. I mean, there really is no certainty. Nobody can truly tell usually what's coming, but we can talk about, as we discussed earlier, kind of categories of risk and kind of thinking about what's happening. An emerging pathogen is really, when you're thinking about infectious disease, things that are caused by microbial pathogens that have really newly appeared in a population, or perhaps they've existed for a while, but all of a sudden they've just shot up in incidence. For example, we've all been following Mpox over the past year or so, and that's been a disease that's been around for decades, but all of a sudden we had a global and a national emergency that was kind of put out by the different governments around the country because of that really rapid increase in cases. So it can be something, that's kind of popping up brand new, like SARS-CoV-2 kind of came out of left field with respect to a novel virus, or maybe an old foe like Mpox or something like tuberculosis that all of a sudden really reemerges and really increases in incidence.
So, Rodney, what things are going on today in today's environment that can contribute to an emerging pathogen and the threat of one?
Yeah, I mean, really, so many factors these days, and many people are going to be familiar with this, but it's worth saying again. Emerging pathogens are really influenced, and I think probably amplified in many instances, by rapid and international travel, right? We can get around the world now in less than a day in most places, so those pathogens can hop on board with us when we travel. We certainly saw that with COVID unfolding across the world. All of the geopolitical disruptions, something people don't often think about is when there's a war, we're dealing with stuff right now, right? When there's war or geopolitical disruptions, borders can become really much easier to traverse than maybe during a normal time period. And so those happen in a situation where maybe mass migrations occur. Again, people coming across, maybe not having the ability, certain governments, to check health records and things like that. So that can certainly play a part in bringing in a different pathogen to a different region. You've got climate change, especially when you think about natural disasters like earthquakes and floods, but even things like artificial intelligence, technological advances, and how that kind of works across how we interpret information and perhaps disinformation around emerging pathogens and infectious disease do play a part in that occurring. So, we could talk a long times about the different factors here, but certainly those are some of the big issues there.
Yeah. Now, in the article, you mentioned a handful of different types of pathogens, and they're kind of broken down by modes of transmission and otherwise. And for example, respiratory and arboviruses, mosquito-borne diseases. And I want to go ahead and start out with perhaps the biggest one, and that's respiratory. Personally, to me, I every year I always keep my eye on influenza because you don't know what's going to happen, and with all the avian influenza going on around the world these days, again, we don't know what's going to happen. So what are your thoughts on things like influenza and like newer strains of COVID and the like?
Yeah, I mean, as the article states, the respiratory cycle will continue. And I think most people, either in the world of infectious diseases or at least in tune with what's been going on, understand that respiratory transmission is such an basically an easy route for many of these pathogens to be transmitted in different environments. So I think you're going to continue. I mean, certainly we're going to continue to deal with influenza. We don't have to get into the total weeds about this, but there's different strains, pandemic strains and epidemic strains. We all are familiar with COVID-19 caused by the virus SARS-CoV-2, RSV, respiratory syncytial virus. I always kind of refer to those three as kind of the holy trinity of respiratory pathogens. They really show up regularly, but even on the radar, right? I didn't really write about it in my article, but we could bring up something that's popped up this year, caused a little bit of a stir, Mycoplasma pneumoniae, which causes walking pneumonia. Really kind of an oddball bacterium without a cell wall, so it's difficult to treat, hard to diagnose. It doesn't come up on a gram stain real well. Typical cell wall inhibitors like beta-lactams don't do much to it.
Right.
So a lot of times walking pneumonia, when people get those infections, they literally walk around with it, and they're not diagnosed right away, and they're not treated successfully right away. And so they can become, carriers and basically vectors. So I think that, Robert, coupled with what we know is going on globally with, we're seeing downward trends in vaccination rates, right? I mean, within the article, I kind of talk about that's a problem. COVID-19, this is coming out of CDC and WHO, but roughly COVID-19 vaccination is lagging. More than 60% of people over 60 are not vaccinated with this year's monovalent vaccine. Only about 16% of people over 60 have gotten the RSV vaccine. There's issues with flu, about the same types of numbers you're seeing, 40, 50% vaccinated. So, and all of that in the background of all three of those kind of amplifying. I mean, we're seeing really high rates. The respiratory season, the activity is really high right now. So it's like a perfect storm for the respiratory cycle to continue.
And concerning prevention, obviously, vaccines are a main tool in the toolbox. And what else do we got out there for prevention of some of these respiratory airborne type
Yeah.
of
Yeah, I think one of the things that's really important to relay to your audience and to anyone, I'll talk about this a lot, especially kind of as we've dealt with COVID over the last 3 to 4 years, is that it's important to remind the public that vaccination is not always 100% going to prevent an infection, but it is going to do most of the time a really strong job at preventing severe illness, preventing hospitalization, and ultimately mortality or death. So when people kind of bring that up, I like to really try to point that out, that it's part of a risk reduction package. It is a multimodal approach or strategy. So vaccination, isolation, physical distancing. If you know you're sick, especially, right? And my wife used to tell me this. This is common sense. It doesn't matter if it's SARS or if it's a stomach bug, right? Stay home if you're sick. She's a pre-K teacher, so she would get really frustrated with kids showing up. Being aware of your surroundings. If you're going into a conference, if you're getting on an airplane, if you're getting in a subway, and you're around hundreds of packed people, you might want to do really well with your hand hygiene. You might want to watch how you interact with people. You might want to mask if you're that person that's really concerned, or you're an immunocompromised person. Covering your cough and sneezes, cough etiquette, cleaning up areas with high touch surfaces, especially in healthcare settings and community settings where you might want to clean up and disinfect common areas. So it's a package deal. It's that Swiss cheese model, right, that we've seen over the last 4 or 5 years. It's not one thing, it's many things that have to be adhered to help lower that transmission cycle.
Let me go ahead and switch gears and talk about the arboviruses, the mosquito-borne and other insect-borne, tick-borne, and the like. Now, we saw a pretty big explosion of dengue last year.
Yes.
And in my personal opinion, I felt the biggest story of the year was Bangladesh. And I kept a very close eye on that. But other things that were not so well publicized were Zika in Thailand. I mean,
right.
They actually had the government coming out warning pregnant women, to protect themselves. Yeah, I mean, dengue was a big problem. Chikungunya was pretty big in certain parts of the world. Latin America got slammed with dengue.
Right.
What are your thoughts on these type of infectious agents for the upcoming year?
Yeah, I mean, you are talking to kind of the core of where I was trained and kind of influenced by infectious disease. And that was through my first career in public health at the Department of Health in Texas and a little time at CDC. So I worked in arbovirology and I worked in rabies, and we've had those conversations about rabies, but arbovirology is exploding. Vector-borne diseases globally are becoming more and more problematic. You mentioned dengue. We had malaria, right here in the United States, pop up in Florida and Texas and up in Maryland, and it did kind of stop, but it just goes to show you that we have vectors here, and they're available for transmission. Dengue, Zika. I think part of the issue, Robert, is that one, it's fatigue. The public is, we've been so beat to death over the last several years about infectious diseases, but Zika was a huge deal. Pre-pandemic, I remember doing stories and talking about Zika. And to your point, you might remember from those years, one of the biggest concerns was that it was showing up in seminal fluid and things like that, and other places where perhaps, and we know perhaps it was problematic with newborns with crossing the placenta for moms. So, some of these are really dangerous types of infections, especially to certain populations. So, I think moving forward, we really need to keep an eye on how we handle that with respect to getting vaccines in the pipeline, to thinking about, I've really been thinking about a story actually about international travel and kind of coming at it from a more global standpoint, right? Because as you've so well put out there in your efforts about dengue and other vector-borne and neglected tropical diseases, most of Americans, I don't think about it on a regular basis until you're thrown into that world. So if you ever traveled, to sub-Saharan Africa, or you're going through the Panama Canal, or you're going to Latin America, you really need to be thinking about talking to a travel doctor, talking about vaccinations and/or maybe some pre-exposure type of medications and things like that. So again, going back to those causes, the global expansion of the vectors due to changes in tropical and subtropical temperatures and humidity, expanding those vectors in their geographic range. I think it's here, and it's probably here to stay unless the world kind of gets kind of tied into that and starts looking at ways to at least slow it down or reduce it.
Yeah, I mean, I can speak for Florida that it was a heavy dengue season, but I mean, this state and probably Texas, in addition, Louisiana and the rest of them have very, very good mosquito control programs. But if you look at all the travel that comes through Miami and through
Right.
Tampa, and it's just from Latin America, I mean, even Cuba, I mean, more than half of all the travel associated dengue in Florida came from Cuba.
Right.
I mean, I mean, hundreds and hundreds of cases. So,
and to be fair, it's just to your point, it's going to be really difficult, right? When you throw in that factor, what do public health departments and governments do? And I think to your point, we really need to investigate control methods that are biologically, stable and aren't going to hurt anything. But certainly we have to kind of be thinking about that as we go forward, because we're going to keep seeing, I think, introductions and increases in incidence of these mosquito and tick-borne and, other types of insect-borne diseases that much of the time we're not, you and I, we grew up in the time where you saw that case and it was like big news, right? And now, to your point, I mean, Florida is inundated in dengue, and it's kind of mind-numbing to think about that's happening, but it is. And so we need to get on board with, not just a U.S., but a global effort to kind of think about how do we attack emerging infectious diseases from a multimodal One Health approach, so that it really kind of ties it all back in.
Well, to piggyback on that, one of the other threats you pointed out, zoonotic diseases. But before we go into your thoughts of it, can you just explain to the audience that may not know what you mean by a zoonotic disease?
Sure. So almost as the term kind of implies, that zoo, so a zoonotic or a zoonosis, whatever word you're looking at there, if you see that word, it's typically talking about an infectious disease that can be transmitted between animals and humans, are typically those that we're talking about. My world started in rabies, but I mean, it's so many of these that most people don't realize that can be transmitted back and forth between animals and humans.
So Dr. Rohde, what are you keeping your eye on in this particular category, and why?
Yeah, the reason I think it's so important, and again, this is kind of the core of where I came out of my education and training, is that when you look at the data, when you look at CDC, when you look at WHO, when you look at PAHO, when you look at other agencies, and they kind of do these large statistical compilations of different research around the world, about 60% of all known human infectious disease agents originate in animals. Mm-hmm. So that is a huge reservoir, right? And so the problem and the complications of many zoonotic diseases that I've dealt with for most of my career is that it's really hard to think about getting a total handle on them, because, there's a vaccination for rabies, for example. And when you use it, either pre-exposure or post-exposure, you can eliminate the disease and save a human life. There's dog and domestic animal vaccines for rabies, but there's always that problem of the virus staying in the reservoir of a wild animal, like a coyote, like a fox, like a raccoon in your world. We have raccoons as well, but just tons on the East Coast. Mm-hmm. Bats, you can't, how do you put a handle on bats? They're mobile, they get around all sorts of things. So until we find a way to, vaccinate a huge percentage of animal populations, you're probably not going to eliminate it, if we're being honest with ourselves. So you have to be really good with public health education, pre and post exposure treatments, all those, again, efforts to educate the public on how to avoid the infection, because it's sometimes a deadly problem.
Yeah. Now, in the article, you write, and I quote, "Ultimately, these types of threats require a One Health approach for effective prevention, detection, and response." Dr. Rohde, can you explain?
Yeah, One Health has been around a while. And so I like to explain it like this when I'm talking to people outside of maybe a scientific background, and that is animal health, human health, environmental health. When you add those up, that's going to equal a One Health approach. So the idea is that this makes common sense, right? But sometimes people don't think about it. You can't just look at humans all the time. You maybe need to consider animals, and to our point earlier, you also need to be thinking about insects and things like that. And then you've got the environment, which we haven't talked a lot about, but environments play a role in the sense that some pathogens can be in water, plants, agricultural types of products and things like that. And even in the sense of surface, when you think about the environment and how things are transmitted. So in healthcare, as you know, some of these pathogens can stay viable on different surfaces. They can be on medical devices. And so it truly is a One Health approach. It's not easy. Nobody said it was going to be easy, but you can't just keep looking at one facet, one silo, and only attacking that, and all throughout that continuum, you have to be thinking about preventative measures and new medications and new vaccines and new post exposure types of things, and perhaps new PPE to protect workers in healthcare facilities and public health facilities. So it is a very large job. But I think now more than ever, the world is in tune with how important this is after a pandemic. And hopefully we will have some ongoing and sustainable efforts in both funding and thought leaders kind of thinking about how to handle these problems.
Yeah. And just to piggyback on what you were talking about a little bit, is the zoonotic infections they're here with us. They're not going anywhere, because it's not like smallpox, which was only a human infection.
That's right.
And you could eliminate it. These other ones, they're here to stay. So we just have to do our best. And
that's absolutely correct. I mean, I talk about that a lot. That goes back to that zoonotic reservoir. When people bring up smallpox and the vaccine, and, well, why can't you eliminate COVID, or why can't you eliminate this or that? And it's like, well, that was a unique situation. I mean, fortunately, smallpox was primarily a human issue, and so once you got most of the world vaccinated, it went away. You can only do so much with certain types of things. I believe the other infection, unfortunately, like measles. All right, we're having a lot of issues with measles and reemerging and things like that. That's actually one that, if you could get a high enough percentage vaccinated, humans are the host, and so if you could get enough people vaccinated, you could potentially eliminate it.
Sure.
But as you know, we've had some problems with measles vaccination uptake and all those things going on, and hesitancy issues. So again, I think that's also a part of the picture that we have to keep working at, is to be very transparent and open, and trying to educate people about how critically important it is to think about vaccination and how important it is to the country and the world.
Yeah. I think polio is another one.
Yep.
Right. And I can remember when I first started doing websites, I don't know, 15 years ago, I remember reporting on India having 350,000 cases of polio in a single year. A few years later, it was eliminated.
I know.
I mean, it's the most incredible thing I've ever seen.
I mean, I will go to my grave stating that vaccination is, there are risks. I would never say there aren't, but the overwhelming majority of of people are going to be fine with it. You certainly should talk to your physician. You certainly should be aware of side effects if that's your history, and perhaps you can't take it because you're immunocompromised or there's some other factor that's going on there. But it shouldn't be because you're misinformed, and it really shouldn't be that you think it's going to cause an infection or something like that. There's just so much going on in the world of misinformation, which my article touches on a little bit at the beginning, and outright disinformation, that it's a problem. And so getting that horse back into the barn is difficult, but I think a lot of us are trying as we move forward.
And I save the best for last because it's something that I do on a daily basis. And it's in your article, you discuss something that I think doesn't get nearly enough attention, and that's the antimicrobial resistance. We have these, AMR days or AMR weeks or whatever, but this is something that's been creeping along over the years, getting a little bit worse every single time. Dr. Rohde, love to hear your thoughts on this. You also being a microbiologist.
Yes, I mean, I would totally agree with what you said there, Robert. I mean, when I moved away from the public health department and came into academia, where I'm at presently, I shifted some of my research from zoonotic agents to MRSA, methicillin-resistant Staph aureus, which is a antimicrobial resistant staph organism. Since that time, I've worked closely with MRSA, but I've also, dabbled in some of the other agents. Unfortunately, there's so many of them now. There's tables of them that we keep track of at CDC, and part of that's in the article. But what's frightening to me is, again, and I use this phrase all the time, these phrases all the time with the public, is that about 1 in 30 people are going to acquire at least one healthcare associated infection when they go into a hospital. And unfortunately, most of the time those HAIs are AMR, they're antimicrobially resistant. It's going to be a problem going forward as we continue to fight this. The World Health Organization predicts that by 2050, we may see up to 10 million deaths, which, if you kind of do the math, just makes me shake my head. It will surpass cancer. AMR could one day be the #1 cause of death. And while it's doing that, it's going to add about $1 trillion with a T, a capital T, healthcare dollars globally. So huge problem, huge global problem. And I sometimes again think that, most of the world, and especially in America, I think because of our access to healthcare many times, give me that antibiotic, give me that antiviral, give me these different antimicrobial drugs, because I don't want to have that strep throat, or I don't want to deal with C. diff, or I don't want to deal with this or that. And it may be working right now, it may not be working. And then we're certainly seeing some infections now where, Candida auris, tuberculosis, extremely resistant tuberculosis, they're not treatable in some instances for TB. So we are kind of at the cliff of AMR, and I think we've worked pretty hard. COVID set us back. I didn't really get into that into my article, but there's plenty of data now showing we took a step back with AMR, because if you think about COVID and what physicians had to do, massive respiratory symptoms, maybe not what we didn't even have testing early on to know if it was COVID or bacterial pneumonia. So they were covering their bases, which is understandable, but many times they were prescribing, large volumes of broad spectrum antibiotics to make sure someone didn't have strep pneumoniae. In reality, they had COVID, and they were helping drive that resistance issue with different microbial flora in the body. So kind of a long answer there for you, but AMR is definitely a priority in my mind, and it could be the #1 issue, depending on how you want to categorize risk.
Yeah. I'm showing my age, but I can remember between the early to mid 80s, I was working in a micro lab in the Philippines, and it was a big shock when we first started seeing the first penicillin resistant gonorrhea.
Right.
Oh my God. I mean, they weren't all, but we started seeing them.
Right.
And go forward 40 years and you can barely use penicillin on very
It's an
few
epidemic. Yeah. And to your point, what's, just those factors again, I mean, it's something we're really looking at in that One Health kind of look, is that in certain places, and in the US is not immune, or they're not completely free of blame, but in many places we do know that you can walk in and buy penicillin off the counter.
Yep.
We know even in some countries like the US, we might be using too much of it in animal types of feed and produce and things like that. So we really need to be thinking about that, because again, showing my age like you, I mean, I can remember my grandmother who lived to be 100, how, I think we've talked about this before. If you talk to your elder grandparents, perhaps maybe your parents, if they're older than you, how antibiotics and vaccines and clean drinking water, they didn't take that for granted. And I think we do in many cases, just give me another pill. We take for granted our water's clean when we turn on the faucet, but in some parts of the world, that's not true. And it's starting to be true here, right? I mean, there are instances where people are fighting to find the right drug combinations to knock out tuberculosis or something like that. So it's kind of scary that it's here, and it seems to be growing almost daily.
So we're essentially knee deep in this already. What can we do about this threat at this point? We dipped our toe in it, so
we have. I mean, I personally think it starts with education, and I know, I know a lot of people say that, but I do think we need to do a better job of explaining science to the public, and sometimes even colleagues that are in healthcare and research, of why it's so critically important to be thinking about antimicrobial resistance, how our use, misuse, how our ability of transporting certain things around the world might have implications, to your point. And this works with zoonotic infections as well, but AMR too. If you're moving animals or produce from one part of the world to the other, and there's a naive population that has never had to deal with penicillin resistant gonorrhea, that's not a great example. But if that's coming around, you're just helping speed up the process, right? And so, I mean, I really think education is behind that. The idea of new antibiotics and new antivirals, that's important, but I think prevention and watching what we're doing with the already known therapies that we have can help slow down. There's a ton of research in this area that we could talk about, and I'm sure you're familiar with, where we're really seeing it's called nudging, clinical nudging, to where we in the laboratory, you and I in the laboratory world, are creating antibiograms and different information to share or not share with physicians, so that they don't feel compelled to treat with status quo. Maybe they don't need to be on certain things for 14 days. Maybe 3 days is enough. Maybe they don't need an antibiotic. Let's get a confirmation of a laboratory test that states that that's not bacterial. You don't need to give them an antibiotic. Let's see if they need supportive therapy or an antiviral or something like that. So there's just a lot, both in the public and in healthcare and treatment modalities, where I think we need to investigate that.
All right, Rodney, I don't know if this is really in your wheelhouse, but I'm going to ask you anyway. How prepared are we in the U.S. and globally for some of these things that you've talked about in your article? Yeah,
so I'm not going to pretend to be, I'm sure you feel the same way. I am not an expert on the global use of pharmaceuticals or topics like that. But with my 30 plus years in public health and dealing with different outbreaks, I mean, I've walked through West Nile virus, I've walked through rabies, I've walked through multiple iterations of influenza, mpox and anthrax, and some other things that have come across my plate in the last 30 years. I think the last pandemic with COVID really caught the world off guard, even though many people were screaming about efforts to be better prepared for some of this. And so I still think we're learning some lessons, including communication of information. I think that's a big lesson out of the COVID issue. I'll be the first to admit, we needed a better way of spreading that information up front, saying we don't know perfectly what we're doing here, but this is our best science to date, and check back in tomorrow. I mean, there's nothing wrong with saying that up front, and I think we didn't do a good job of that, and we tried to get better at the end. But now, as you know, it's harder to turn people's opinion once you're there. So I think that's part of it. Funding, I think Congress, they jumped on board, and we saw some good stuff coming out. But will it be maintained? Will it be sustained? I probably mentioned to you, if I haven't, I write about this often. Pathogens and AMR associated with pathogens and things like that have killed more people than all wars and terrorism combined when you start looking at the data. Why we don't treat infectious diseases like an enemy and have sustained public health funding and healthcare funding to kind of tackle some of these problems, I'll never know. Hopefully we're learning some of that, and we're moving in a way that maybe that gets better. There were some good steps early on. Now I think we're going to have to watch and kind of see what happens. But funding, communication, I think, are two big tenets that we need to kind of watch, and then the research, which is kind of tied to funding. How do we deal with a national testing strategy? I mean, what a mess, right? During COVID, we need to figure out. We can't do that again. We need to figure out how to be transparent. CDC is not a reference lab. They're not made to do 1 million tests a week. We need to jump to corporate and other types of reference labs quicker. We kind of learned that when we dealt with Mpox. Mpox was a good reminder, by the way, because we were kind of starting to ease into, we're done with COVID, and we're not, by the way, but we're kind of, seeing those declines. And Mpox was kind of a reminder of, oh, dang, we got another one on our shores, right? And I just think we're going to continue to see these things.
Mm-hmm. Okay, well, let me go ahead and show the audience your article. It's entitled Emerging Pathogens, A Look Toward 2024. And that's by Dr. Rodney Rohde, and it's in the journal Today's Clinical Lab. And I'll link to it in the show notes for anybody who wants to take a look at it. It's a quick read, so it won't take up a lot of your time, and it's an easy read. So I encourage you to check it out. And I want to thank you, Dr. Rodney Rohde, my friend, for joining me once again here on the program. Thank you, sir.
Yeah, thanks so much, Robert. It is truly a pleasure, and I do appreciate everything you do for communicating these types of topics. So thank you, and Happy New Year again.
Same to you and yours.